So I'm just gonna do a quick little demo, quick little video. I've kind of already talked to you about, things like the density of the ball. You can increase pressure to have it penetrate more. You can decrease pressure to kind of increase the surface area so that it spreads out instead of in. And that's kind of encouraged when we're first starting out. That you want to, again, our focus isn't force, our focus is like connecting. So we're not just trying to just like dig in as far as we can go. We're trying to kind of let our tissues soften and settle around it. In nervous system language, we're trying to invite safety into the body. And so we do that through breath, through awareness, through adjustments in pressure, through active participation. And these are all things that we've kind of touched on before. So again, I don't want to dive too far into it. What we're gonna focus on is like inviting awareness and mobility into the viscera, and so there is things, like the psoas goes from the low back to the upper thigh, and you've got your abdominal muscles, you've got your organs in here, you've got a lot of connective tissue that kind of wraps and intertwines around all that stuff, and so that's kind of what we're going to focus on. So even when we're inviting some active squeezes or whatnot, we're kind of focusing on this whole area, remembering that the core, is the pelvic floor, down the legs, diaphragm, kind of bottom of the lungs, and then our entire cylinder midsection as well. So we're inviting mobility into this area that tends to get like rigid and guarded and energetically cut off. So we'll be starting important landmarks. You have your ASIS. They're your hip bones that stick out of the front of your body. And you can pretty much find them relatively easy. They're just the most forward bony spot. So feeling around there. So that'll be spots we stop on. Your pubic bone, which again, the actual bony spot where your abdominal muscles insert, and then bottom of your rib cage. We've got your, the little U shape at the top here, and then it kind of goes around, and so the lining of the rib cage is also areas that we're going to focus on. Belly button is another important landmark. We'll be utilizing these things as landmarks. So what we'll do is we're going to start off kind of on one of the hip bones, and we'll invite some breath, and then we'll probably roll in a little bit towards the pubic bone. So again, you got hip bone, pubic bone, hip bone. Keeping that triangle in mind is a really good thing to remember. And we're going to go from hip bone, and we're rolling in. Now we're kind of like on the track of the psoas. We'll be inviting some active participation at some point, and then we'll start to gradually allow that tissue or the ball to work its way up, to the diaphragm, somewhere up in the mid to upper abdominal area. And then we'll do the same thing on the other side. Hip bone rolling in, working our way up. And then we'll probably pause or invite some time here at the diaphragm, and we'll kind of go from there. Again, the things to remember is breath and awareness, active participation, squeeze, controlled release. We want to pay attention if there's any times where we're guarding or clenching, then these are indicators that we're doing too much. And we want to soften out of it a little bit. You want to give the tissues permission to soften into the pressure. So trying to keep that in mind. This isn't a no pain, no gain situation. This is listening to the sensations of the body instead of like what the mind wants to do. So we kind of utilize that while we're here. So we'll go ahead and get started. We'll start on the right side. So again, right hip bone. And we literally just find that hip bone and let ourselves settle onto it. There we go. facing you. So we'll be, so I'm right on that hip bone, and we're just letting the pressure settle in. So if we want to let it sit for a little bit, and we can kind of let ourselves soften into it a little bit here, just letting gravity and time, do its job. This bony spot is where a lot of muscles insert. It's a juncture point for lots of stuff around the front side of the body as well as stuff around the back side of the body. So we want to give it its due diligence. This is an area that a lot of practices overlook. There's not a lot of emphasis on bony prominences. So we just allow breath and time to do its thing. And time is our best component here. We want to allow time to do the work. And we're not trying to be in a hurry. And utilize that breath, finding its way down into the lower abdomen, down into the hips, the thighs, the lower back. Noticing how the body responds to that exhale and the pressure, where it resists or softening, or anything else we notice. You might notice twitching, fluttering. You might notice sensation going to the back body, to the opposite side. Just practice noticing and breath. Now, after about 3 to 5 breaths in this area is where we're going to move on for this particular demonstration. Outside of this video, we would allow the tissues to acclimate, which is where sensory information kind of equals out. You kind of get to this feeling of completion, and then you move on. But for now, we're going to stick with 3 to 5 breaths. So we're going from the hip bone, roll that in closer to the pubic bone. When you have lymph nodes, you have, your circulatory system, you have things that pass through this area. But as long as you're listening to the body, there's nothing that's going to be damaged necessarily. Obviously, if you have any sort of other issues in that area, perforations or whatnot, it's a whole completely different circumstance. We're just going under the assumption that we don't have any of those issues going on. We're just dealing with mobilizing tissue. And so even here, we can start to invite a little active participation. You can kind of gently start pressing the thigh down into the ground, gently inviting a little hip flexion action. Maybe a little bit of lifting up, pressing down. We're kind of lengthening that hip flexor, pressing down, going from a gentle squeeze to a lengthen. Again, we're listening to the tissues. We're not doing anything sharp or fast. Maybe a little bit of rotation in the thigh bone if you have the mobility. Maybe just kind of rolling it out to the side. Keeping that breath flowing down into this space. After about 3 to 5 breaths, we're gonna bring that ball right onto the pubic bone. So now we're right on the pubic bone. We're not below it, obviously we're not on our bits, but we're right on the bone itself, right at that insertion point. And then again, a lot of times it's very sensitive. I've done this a lot, so it might look like it's not gonna be sensitive. For lots of people, it is. So maybe we have to start off a little bit supported, or maybe a little bit of flexing the hips a little bit to, take some body weight off of it. Again, inviting breath, letting the tissues soften around this pressure. We might notice, as we're softening into it, this pubic bone, the opposite side of it, we have that sacrum area. A lot of times there's pressure on the back side, that as we invite this awareness to the front side, to the pubic bone, it starts to do some interesting things. So we allow breath and noticing. Notice if the glutes are clenching or the pelvic floor. We invite the softening. Often having our eyes closed, just letting breath do the job. Maybe we invite a little bit of active participation here. A couple rounds of maybe gently drawing the pubic bone up towards the belly button, almost like you're doing a little sit-up. Thinking of those tissues from the rib cage to the pubic bone. Squeezing. Nice controlled releasing. Squeezing. Nice controlled releasing. We really want to let ourselves explore that controlled releasing when we're doing these active participations. As we release in a controlled manner, is where we'll really notice any sort of stuttering or jumpiness or twitching. And these are indicators for areas that need to be explored a little bit more. So we let ourselves watch that, that controlled releasing. You might notice a difference on left side or right side. Just let yourself notice. We can explore this area further again, but for time's sake, 3 to 5 breaths, then we'll move on. So now we're going to stick with that right side, and we're going to roll ourselves back onto that right side, and then now we're going to roll ourselves down a little bit. So what we've done is we've gone from hip bone to pubic bone, and then we're going back to the in-between hip bone, pubic bone, and then we're rolling up slightly. So we're on that lower abdomen. This is one of the best areas to it's where the psoas is kind of mostly on the surface right before it crosses through that inguinal area. So we want to allow ourselves to hang out there for a little bit. Again, letting breath do its job. Breath and noticing. Again, we might invite a little squeeze into this area. You can think of flexing the thigh down into the earth. You can think of curling the toes, lifting the thigh. You can invite a little rotation. Or we can completely lift the leg. Again, this is all listening to your degree of mobility. The goal isn't to see how much you can do. It's just to kind of explore these different things, see what occurs when we attempt these movements. Where do we soften? Where do we start holding our breath? Where does things start shooting to other areas of the body? Where can we soften? And again, for time's sake, after about 3 to 5 breaths, I'm going to kind of keep some pressure on that, rolling that ball up a little more. So now I'm about equal to the belly button. And this is the areas where we're connecting with the organs in this area. So as we exhale, we'll notice that it starts to become uncomfortable. It starts to become, I want to say painful. If it's painful, we're doing too much. But it should be like hurt so good,
You might notice gassy stuff as we kind of start to get in with the intestines. You might notice stuff shooting through to the back body. And we allow the breath and we pay attention for those edges. Again, we're not forcing or hurting or trying to push past some barrier. We're just letting our breath invite this gradual softening. Like I just noticed that I was squeezing my glutes. So I invited myself to soften, which allowed the abdominal area to invite a little bit more pressure, to invite a little bit more softening. Again, that connective tissue that wraps around the organs that gets clenchy when we have this like, this pit in our stomach. You know, this is often that shrink wrap effect of the fascia around our organs. So we invite this softening. Maybe at a certain point we allow ourselves to soften, maybe we don't. You know, maybe we have to continue to hold ourselves up. Again, there's not a right and wrong. There's listening to what the tissues will accommodate and where their edges are. This is the practice for connecting to the body on a sensate level. So don't let your mind, don't let the ego, I should do this more or better. None of that. This isn't the time and place for that. This is the time for listening. You know, it might be called for to invite a little micro movements as we're here. You might notice a little bit shifting to the left, a little bit shifting to the right, kind of changes the experience. Let yourself play around with some micro movements. We don't want to roll. We don't want to be rolling a lot. You know, but little micro movements, you know, it changes a slight kind of vector at which this pressure is going in, and you engage with different tissues. So let yourself explore your body. Let yourself explore this area. Again, 3 to 5 breaths for the sake of this video, and we'll move on. And we're gonna roll that up to just underneath the rib cage. This is an area that often gets a little clenchy for people. In traditional Chinese medicine, they consider the liver area an area of which like anger, resentment, things are stored. For me personally, when I'm doing a lot of conditioning stuff, this is the area where I start to get that stitch. There's a lot of stuff hanging out in this area, so I'm kind of letting that ball work its way underneath the rib cage, the upper abdomen, upper abdominals, kind of making its way. Well, the way I'm positioned now, it's actually kind of heading up underneath my rib cage a little bit, getting into those insertions around the diaphragm, those connection points. You know, it's almost every time I exhale, it feels like my rib cage is almost attempting to swallow the ball, which again, body type and composition affects this experience. That's not the experience you're supposed to have. We just allow breath and softening and allow ourselves to have whatever experience we do. See, and after a few rounds, my body starts to acclimate, starts to invite. I notice that sinking in a little deeper. And I start noticing a sensation for me personally right now going up towards my thoracic spine. So we let the breath and the softening do its job. Maybe again we invite a little squeeze, controlled release. Squeeze, controlled release. Just had a little audible adjustment in my spine. Not on purpose, but things happen. Noticing that my palms, my feet have gotten a little sweaty. This often happens as we're doing work around the abdominals, the psoas, this diaphragm area. This is how we can tell that the autonomic nervous system is being connected with. You know, when we're first starting out, maybe we don't spend as much time. Maybe we only spend 2 to 3 breaths in an area and gradually invite ourselves off of that. Maybe 2 to 3 breaths in an area.
And then before we transition to the other side, we pause, check in, kind of assess. There's a lot of heat, a lot of circulation in this area. I can feel it going down into my thighs and through to my back. So we just kind of check in, notice movement, notice breath. And then when you're ready, you'll go ahead and do the other side. For the sake of this video, I'm gonna stop it here and let you practice yourself, but I encourage you to let yourself explore this pressure. Again, we're not trying to get through it quickly. We're not trying to hurry up. Maybe a little bit of rolling it in or out, like micro movements, again, changing the direction of pressure. But let the breath do the job. And practice noticing. Remember, breath and noticing is how we take the excessive noise in between the ears and we invite it to draw down into this space of the soma. Remember, psycho, soma, psychosomatic. So let yourself shift that awareness down into this giant surface area body, this soma that we have. Anyways, I'm going to stop here. Happy explorations. Any comments or whatnot, feel free to ask, and maybe some clarification can be presented.